was working in the hospital, in Veterans Hospital. During the winter time, we found that staff members developed herpes, simplex, around the mouth area, and some of them had really swollen up that they had to cover it. And then other ones had, some patients as well, had herpes zoster or shingles on the chest, around and in the back. And then I did some private patients who had genital herpes as well, which I treated. The men were easier to treat, the women, but the men were easier to treat. And I found out, not accidentally, but my best friend developed a herpes that it was like a big blister. And another friend lost her eye because of herpes was in the eye. So I was working with the different positive or negative electrodes, and was quite interested with the nerve regeneration. And I said, well, it's something to do with the nerve, and the doctor explained to me, well, it's a virus that comes along the nerve and goes to follows the dermatome, and it's like a cancer. It multiplies and produces pain and an open sore. So I thought, well, I will try to stimulate the nerve and maybe strengthen the nerve, because when you have a virus going along the dermatome, the nerve has a positive and negative charge, and then usually the nerve charge are equal. When you are under stress or some problem in your life, the nerve dermatomes suffer first because they are on the surface of the skin. And the dermatomes lose the negative charge or the positive. We were not quite sure which one. And the herpes virus, we all have it, stays in the anterior horn cell, and when the dermatome nerve is weakened, it goes along the nerve and comes to the surface of the skin. It could be around the lips, it could be around the chest, which is a 9th dermatome. Then there is one a 10th and a 11th dermatome, and genital dermatome, and going lower down. So when we decided, well, that's because of the weakness, will I have something to strengthen or get the positive and negative charge equal, so that the virus, we did not know. We cannot destroy the virus with electrical stimulation, but what will happen? So we tried, and what happened, by placing the electrodes that produce the direct and alternating current superimposed, because you need the positive and negative charge as well as the movement. And we placed along the dermatome. In the face, we placed the electrodes over the trigeminal nerve. We started from the back, but then finally we ended up by doing it right here and away from the sore. and only for 1 minute, very mild, very low frequency, couldn't feel anything. And then the next 1 minute along the both sides of the virus infection, or virus, whatever you call it.
The site.
The site. And what we did, we found out that after 8 hours, there was a change. The virus did not multiply anymore. A duplication of tissue did not appear. The pain disappeared. And I had 100 patients went through the same technique, and 100 patients reported 8 hours. So it's 8 hours from the time you do your treatment. And we found out that with the herpes on your lips, around your face, it took one treatment. And any dermatome, herpes zoster, took 3 days. But the same technique was done. This dermatome from a vertebral spine to wherever if the sore was here, we put away from the sore, and then both sides of the sore with electrodes. So I was thinking that with the SCENAR, the probes that we can use, I have never tried, but I would love to try the same technique. Not to relieve the pain, but to increase the strength of the nerves. The doctors were involved as well, quite because their wives had problems with their herpes, and we were treating them as well. And they found out that the herpes goes back to its resting place. We don't destroy it, but we strengthen the nerve, and the virus goes back to the anterior horn cell.
What were you doing for the genital herpes?
The genital herpes the same way. We put it on the lower spine, and then for the men, we were right onto the penis, wherever very mild, so there was no problem. We didn't have a probe, we didn't have a tool for the women, but we did the pads closer to the vagina. And it helped, but it didn't work. For the men, it worked.
And how long you did this?
With electrodes. We used the copper electrodes. And then we also use the zinc.
Yeah.
We use the zinc electrodes because you can mold it.
Yeah.
You can fold it. Well,
And what was your source of direct current for that, and what kind of equipment were you using?
well, we used at that time we had interferential current.
Oh, interferential, okay.
Which was an equipment was already done that has the alternating and direct current superimposed.
Okay.
Because you need both, and I think they have both. The SCENAR has.
Okay.
So kind of interesting thoughts, right? How dermatomes and nerves and all the stuff fits when you look at it. So.
Yes.